Hi, everybody. Good day. My name is Sandra Anyahaebi, and I am a psychologist and also the founder of Psych Foundation. So, Psych Foundation is an NGO here in Nigeria that helps to raise awareness for mental health. We also provide free virtual counseling for individuals, basically, not just Nigerians, but literally anybody and everybody. That's just a brief.
Okay, thank you for joining us today. So,
Okay, you're welcome.
sorry about that. To delve into the topic, first, I would like you to just give us a brief the definition, of postpartum depression. What is postpartum
Okay, so
depression?
all right, so I'm just going to make it as simple as possible, right? So postpartum depression is just it's more like a mix of changes that goes on both physically, emotionally, psychologically, with women, especially after birth. So that's just the simple thing about it. It's just changes that happen with a woman after birth, both physically and emotionally.
Okay, so are there symptoms, are there specific symptoms that a woman
Okay.
should look out for after giving birth? Does it happen immediately after giving birth or weeks down the line?
All right, so we know that there's this thing about when a lady gives birth, it's supposed to be this time of so much joy, this time where
Yeah,
you have this, oh my God, my baby, oh my God, this, oh my God,
yes,
that, right? It's supposed to be a time filled with joy, happiness, you're in awe of your child and things like that. People are celebrating you, right? And that is how it feels for a lot of women. But unfortunately, for some women, it's quite the opposite. There's a lot of sadness going on, persistent sadness within this period. There's a lot of anxiety. There's a lot of fear. There's a lot going on with them at this time. And people, though most women tend to experience baby blues, the usual sadness that comes with after giving birth. Maybe you're conscious about your body size. You're conscious about the physical changes that your body just went through, and so many things. Yeah, there are so
yeah.
many people tend to experience baby blues generally. But then when it becomes persistent, you have this long time of long sadness that it feels like you're not able to get out of, right? A couple of other. So the thing is, postpartum depression is a kind of depression, right? It's a type of depression, but just mainly with women after childbirth. So now what happens is that women who are experiencing postpartum depression also experience the symptoms are similar with that of depression. Feeling hopelessness, long-term sadness. For women in this category or experiencing postpartum depression or PPD, as people call it, they tend to also have issues bonding with their child. Issues connecting with this new baby that they just had, and
Yeah.
also there's this feeling of sadness. Sometimes some of them even feel like harming their child or harming themselves or anybody around them, right?
Well,
So
that's
there's yeah, that's the thing. So it's actually very serious. You see, hold on, let me read this for you, right? So postpartum depression is one of the most common complications from childbirth. It's one of the most common from childbirth, and one in seven women actually experience postpartum depression. But unfortunately, people don't talk about it. We don't talk about these things because
yeah.
there's so much stigma attached to it. Especially in our culture, where if a lady comes up or complaining about childbirth or even the usual during pregnancy, she's just feeling tired, people tend to just have one or two things to say about it. Oh, stop being lazy. Oh, people just try to make them feel like, oh, what you're going through. Are you the first woman to get pregnant? Are you the first woman to give birth to a child? So these things tend to make people make because a lot of women actually experience PPD in Nigeria here. A lot of women do, but the problem is just that our society have shunned these women for so long that it's almost like a taboo for them to come out and speak openly about it, right? So it becomes a problem. If only we as individuals, if we can encourage you see young mothers, you see women, you see people who just gave birth. It's not something, it's a time of joy for every single person. Some mothers may mask it and be like, oh yeah, I'm happy, my new baby, all of that. But if you're really concerned about, say, a friend, a family member, or whoever, if you're really concerned, go ahead and ask them, how are you really doing? If you can even offer support, help take care of the baby while the mother gets at least enough rest, right? That would really, really help them, because this is a very critical time, like not critical per se, but it's a very sketchy time for them. And a lot of mothers are not sure about the emotions they are feeling, right? They're not certain. So many things are going on. You just gave birth. Your body is yet to bounce back. You're yet to even get over all the pain you're probably going through and so many things. And this is not a time for these women to start experiencing the stigma of, oh, stop acting like you're the only person that gave birth, right?
Okay,
So yeah.
so as not to get too far into what you're talking
Hmm.
about now, I'm really enjoying all you're saying. But what are like three basic symptoms that a person can look out for? Like a woman
Okay.
that has just given birth or her partner, what are the three basic symptoms that she should look out for?
All right. So I always tell people these things, right? When it comes to mental health related issues, right? Sorry, I'm looking at the comments. Please, if you have questions, I'm sure there's a question sticker. You can
Yes,
use that so she
that
can find the
question, we are
questions
going
afterwards.
to answer questions at the end, ask questions at
Yeah.
the end of the session.
All
So
right.
yeah.
So, like I was saying, when it comes to mental health related issues, just like your physical health, when something is wrong, you know. That is, if you're being honest with yourself, you always know, right? So, but some things that you as an individual you can look out for is when you're feeling, really, really sad. You're crying all the time. You're feeling really down. You're feeling really sad, but you just can't get out of it. Even when probably people around you are all cheerful or happy, things that generally should make you happy, but they are not really making you happy at that point in time, right? Feelings of guilt and serious or a lot of anxiety, right? Those are things that you as an individual you can look out for. And then if you have somebody who just gave birth around you, possibly your partner or your sister, your cousin, whoever it is, watch out for them. If somebody is sad, you would really know. For a mother who just gave birth, most times people tend to say, oh, it's something that is the most beautiful experience in the world, right? That is what they say. So that person should be feeling really elated. You should be feeling really happy and going. So one thing that you can look out for, if you have a friend, a family member, whoever, you can look out for their physical changes. When I mean physical changes now, like are they always down? They're not really interested in doing anything. They probably speak about how scared they are of taking care of their baby. They are scared about holding their child. They are scared that they may not be able to, they are not connecting with their baby as much as they would want to, right? These are things that you can look out for when it comes to a friend or a
Okay, so
family member.
okay, yes. So you're trying to, or what you're saying exactly now is the baby blues are different from depression, the
Hmm.
postpartum depression.
Of course.
So like what's the big difference that you mentioned earlier that I remember is how long it takes. You said the baby blues lasts for
Hmm.
a while just after giving
Yeah.
birth. So are you
All
trying to
right.
say yes, so what's the major difference? Is it just the time?
Okay, so you see the same way people tend to use the word, oh, I feel depressed, oh, I'm depressed, oh, I'm depressed around. I'm not trying to call anybody out or anything, but if you do feel depressed, chances are you may just be experiencing you may just be experiencing sadness over something. But that does not mean if you are worried about something, always speak to your professional, always speak to a mental health professional about it, right? So just the same way, there's a difference between sadness and depression, right? There's a difference between sadness and depression. So the same thing, there's a difference between baby blues and PPD, postpartum depression. So the major difference that I can say right now, the major difference is the time frame. So usually baby blues, after a couple of weeks, a couple of months, some people tend to just tend to fade off, right? But with postpartum depression, you can even find some women experiencing PPD for like up to a year.
Wow.
Yeah, so it varies. So many
So even
people. So
while the
something
baby
else.
is older,
Sorry.
so even while the baby is growing older, the feeling is
Yeah,
still the same.
yeah. The feeling is still there. So the thing is, whenever you notice this kind of changes in you, it's really important that you seek proper help. Even if you feel like it's just baby blues, it doesn't hurt. I mean, they're not going to prick your body with injection. Just speak to somebody, speak to a therapist. It doesn't hurt to actually do that, right? So the major difference is the time frame, and also the different kind of symptoms that accompany it, right?
Yeah.
Baby blues, you may just feel like after a while you're fine, but when you begin to feel excess guilt, you're scared about holding your child, you're there's a lot of anxiety going on, then you should speak to somebody about it.
Okay, so okay, thank you. So are there
So,
like triggers that we should look out for?
so
Something
I'm
that
going to
like, or risk factors, some things
So
to
I'm
look
just
out.
going to cover all of this under like courses basically, right? I'm going to cover all of that under like courses. So yeah, we can't just pinpoint to, oh, it is just this one thing that is causing postpartum depression, right? We can't say it's just this one thing that is causing postpartum depression, but there are a couple of things that could contribute to PPD. So one of the most one very sorry, I'm not going to look at the comment section again. So
Try not to.
yeah, so one that you could actually say, okay, this actually contributes to PPD is the genetics, like hormones, right? After childbirth, there's this decrease in estrogen, like there's a decrease in the level of estrogen in your body as a woman, right? So studies have shown that this could actually contribute to women experiencing postpartum depression, right? That is one. Then also there's the sorry. So also there's you know how there's this thing that happens when women just give birth, right? You're taking care of the child. You have to take care of yourself. You have to feed the
Yeah,
baby. You have to prepare meals for your home. For some women, there's so many things. For some others, they also want to catch up with work. There's so many things going on, and you find out that the mother is overwhelmed and she's stressed out and she's not even having enough sleep. So lack of sleep is something else that could also trigger or contribute to postpartum depression, right? Because the more if you are not getting adequate sleep, it becomes difficult for you to concentrate on your even something very simple. It
that's
becomes really difficult to concentrate,
yeah,
right?
that's
So
very
imagine if as a student you didn't sleep overnight because you're preparing for an exam, and then you're entering the exam hall, you're all, oh my god, oh my god. Before you know what's happening, you're forgetting some of the things that you read. So imagine a mother who has so many other things on her plate, and
and
then
you
having
just
to deal with a whole new human being, a
uh,
whole new human being, and you're not getting enough sleep and rest. It's going to
yeah,
tell on you. So I always encourage people, try as much as possible to get sleep. If you can outsource, speak to family members. It is okay. That's something else people need to know. It is okay to ask for help, right? This is a very challenging time. It's not something that you should stress and keep all to yourself. Oh, I can handle it. I'm a superwoman. You asking for help does not make you any less of a woman, right? If anything, makes you a smart one because you care about yourself and you care about your child, right? And then there's also anxiety, right? A lot of people, especially for new moms, you realize that they are very anxious about, oh, how do I change a diaper, or how is it pronounced? How do I take care of my baby? How do I do this? How do I bathe my child? There's so many things they're worrying about, and it could lead to anxiety. And then anxiety, it begins to lead to postpartum depression. And then one last thing I'm going to mention under causes or contributing factors is self-image, right? We have this, we know that the female body goes through a lot of changes before and after childbirth. You go through a
yes,
lot of changes, right? So for some women, they tend to become much more cautious, much more concerned, and they're paying much more attention to their body. Oh, why have I not? What's that word? There's this phrase people use very often after childbirth. Bounce back. Why haven't I bounced back to my
yeah,
body? Why haven't I done this? Right. So you're very you become very cautious, and then if you're not somebody who you're not as confident as other people, say maybe your self-esteem level is not as high before childbirth, you tend to start comparing yourself with other mothers who after childbirth, just like this, they're like back to themselves, and all looking like, yes, thank you, all looking like, you know, it becomes really difficult for you, because now you begin to compare yourself, you begin to compare your progress, you begin to compare your journey. Please remember, a human being just left your body. So it's
I know.
okay to take your time. I mean, normally, I don't even expect anybody's body to like bounce back that fast, or even bounce back in the first place, right? Because, I mean, we're talking about a child, human being that you're going to a whole human being, yes, right. So it's something that we should be careful, and especially when it comes to self-image and the way we view ourselves. I always encourage mothers, um, during childbirth, the moment you find out that you're pregnant, say a few months to your due date, I always encourage, try to go to therapy, right? It's going to help you to, you know, just refocus your mind. Your therapist probably would also try meditations with you, mindfulness with you. These things will help you keep grounded. They'll help you keep, you know, keep to earth, to keep to earth, or wherever it's called, you know, just to help you process things and manage things better. And then it's no longer a new thing for you when after you give birth, if you begin to experience postpartum, you know, okay, so you've been equipped beforehand, you know how to manage them.
Yeah, yeah. I mean, okay, so that means that if a person has had mental issues before giving birth, that there's more reason to actually go into therapy after giving
Yes,
birth.
even before, after, in fact, just prepare your mind, because experiencing a mental health issue during childbirth or before childbirth, say for instance, you've been diagnosed with, say maybe anxiety, for instance, let's say you've been diagnosed with severe anxiety before you got pregnant, chances are that after childbirth, you may experience, even if you've been doing so well before, this is not for every single person, however, but even if you've been doing so well before, chances are you may begin to have episodes of anxiety again. You may begin to experience one or two things, you know, because now you have to deal with not just yourself, but you're responsible for taking care of somebody else. So if
Yeah,
you were diagnosed with anxiety, like I said earlier, it's really important that you go to therapy before and after your delivery. It helps you to gain more coping skills on how to manage the whole situation.
okay. Okay, so
Yeah.
can be taken, or is it just therapy? Because you mentioned therapy. You said immediately after you give birth, find yourself a therapist immediately, yeah? But like, are there medications that you can also take after?
All right. Yeah. So personally, I am also a drug use prevention expert or drug use prevention professional. So there are some things I try to not do. For instance, I will not mention some medications on this live session, right? Because people tend to self-diagnose a lot, and it leads to more complications, more problems, right? But yes, there are medications used in treating postpartum depression, just like there are medications used in treating depression as a whole. There are some medications used in treating postpartum depression and a couple of other things. So most times, in cases of severe postpartum depression, for instance, psychotic PPD, right?
Yeah.
Your therapist may refer you to a psychiatrist who will prescribe medications for you that you can use together with psychotherapy. That's talk therapy, right? So yes, medication is not ruled out. So yeah, you can use medication and psychotherapy.
Okay, so if I was a mother just now, a new mom, so if I take the medication, can I still breastfeed? Because that's like a fear. Can I still breastfeed my baby if I do take it?
Okay, so I understand that. I am not a medical doctor. I'm only a
Yeah.
psychotherapist. I am not a medical doctor. So, but some women may experience some side effects or whatever, but I can't tell. So the best thing is, why, if you have been prescribed a medication, consult with your medical doctor also to confirm if this you can go ahead. It's just like, for instance, let's say after giving birth, I think maybe a new mom has, maybe she started having malaria or something, or headache, or whatever the case may be, and they are prescribing drugs for her or medications for her. You find they'll tell you, oh, okay, speak to your doctor and confirm that you can actually take this medication, right? It's basically the same thing. So if your psychiatrist prescribed a medication for you, please speak to a medical doctor also and confirm that you can actually use this medication while breastfeeding.
Okay, so let's say a hypothetical situation here where I mean, a 30-year-old woman, finally, or maybe not even, let's forget about the age. A woman just had a baby, yeah, but before, prior to the pregnancy, she never had any sort of mental issues, yeah. And you know how tough and how expensive it is to get a therapist. But let's say during the pregnancy, she started feeling some sort of anxiety as a result of carrying a baby, and then what happens after she gives birth and all.
Yeah.
In a case where she can't easily afford to see a therapist, what are the other options?
All right. So there are some self-help options that you can opt for. Meanwhile, please remember self-help options are not to rule out therapy. They're just a means to help you cope before you can afford therapy. But I always encourage people. You see the same way you're always preparing for. You see the same way you're always preparing for antenatal. You know, you're saving up for things like that, saving up for your baby clothes, your baby trips, and all that. Please also just save a little bit for therapy. It's very important. Self-help, as much as you want to, self-help, they work amazing, right? Self-help tips work amazing. But then again, you're also going to need the help of a therapist at some point. You're also going to need to speak to somebody at some point. So while you are keeping out money for, baby shirts, baby trousers, baby shoes, all of those things, please just put in, you can note it self-care, just put in a little bit of money out just to help you save up for them. So there are some self-care tips that you can work with. So for instance, remember we spoke about sleep, right?
Yes.
We spoke about sleep earlier on. Please, 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 if you're a new mom here, I mentioned it earlier, please try as much as possible to get enough rest, right? There's no medal that is being handed to you for saying, oh, the most overworked mother. Please, there's no there's no medal being handed out to you like that. Even if there's a medal, it's not attached with money. It's not attached. So it's not it's actually not giving you anything. So please, I mentioned it earlier, if you can outsource it. If you can call family members for help, please do. If you have I trust and I believe that most mothers here have supportive partners. Please
Yeah.
lean on people around you, lean on them, let them help you, allow people to actually help you. And then don't put so much pressure on yourself, right? There's this pressure that a lot of people just tend to, in fact, not just mothers, generally in life, we tend to mount pressure on ourselves, especially when something just happened, maybe a new job, a new career, a new city, whatever it is. We want to do all of these things at once. Please remember, there is no award being handed out though. You are the most important thing at this point in time, right? You are one of the most important things. So the moment you are able to take care of yourself, then you'll be able
Yeah.
to take care of people around you. So and also it will also help you to practice mindfulness, right? Mindfulness and meditation, exercising. When I say exercising, I'm not talking about the rigorous go to the gym and pull everything pullable, please. That's not what I'm saying. So you could use meditations, yoga, the light exercises that you can do. Try to just get your blood flowing. Try to just move your body. Mindfulness helps you to keep yourself grounded, right? Go online, search for mindfulness tips, go to YouTube, follow some of these people that do yoga. You can even contact, what's her name now? Tunde, Flow with Tunde. I can leave her handle in the comment section later on. She does amazing yoga sessions and she helps literally everybody. She has different sessions for people, different people, dance sessions for anxiety, for just stress relieving, just to do, different things. There are so many things that are popping up these days, and that's one good thing that we have, right? People are evolving, mental health related things are evolving, right? So there are so many help that you can get. Also, please try to spend time with your partner, right?
Yeah.
I know this is a time where we're all focused on the child, you're focused on the baby. Oh, the baby needs this, the baby needs to rest, the baby, by the time you're done, you're as exhausted as you can get, right?
True.
Remember, outsource, share chores, ask your family members to help you with chores or whatever it is, and then spend quality time with your partner. At this time, it would really help you to, this is a time where you need to open up to people, right? This is a time, if you are really struggling with one thing or the other, this is the best time to open up to people around you. And who best if not your partner? So spend quality time with them, right? And I just hope that most of us here have supportive partners. And then, like I mentioned earlier, family members are key. Support systems are crucial, like they are important, right? So lean on people, allow these people to help you. I know some mothers that are like, oh no, I'm fine, I'm doing okay, I'm doing fine, because it's hard for you to lean on others. You don't want people to say you're a lazy mom. You don't want people to tag you for something that you are not. But please remember that that is not important right now. Like I mentioned, the most important thing is you. If you are healthy and you are doing fine, you'll be able to take care of your own child as much as you want. So delegate things, give chores to your friends, your siblings, whoever comes around to help you. Speak, open your mouth. If you're feeling any kind of way that you know it's something is wrong, please speak out. Talk to your friends, talk to people that you really trust, talk to your partner, right? And then hopefully you guys will be able to find something that works best for you. And then if last thing, find a support group to join, right? That, like I mentioned, there are so many mental health resources right now. Some organizations offer support groups. I know what's it called now? PSN, um, post, I think Postpartum Support Network. I think that's what's called. I can't remember, but I think that's what's called. Yes, I think they do have. Sorry.
There's some, you're mentioning some groups that can help
Yes.
with.
Yes, so these people actually help. They have support group sessions. So just check online. If you're not sure, I'm always a DM away. I can help you to find some that can help you out. Join a support group. Because I know that because of the stigma, a lot of mothers tend to not speak about it. But if you join a support group, you have a lot of other people going through what you're going through, right? So it becomes easier for you to express yourself.
Okay, so you touched on my next question. So as a
Okay.
partner to someone going through depression,
Sorry, I
as
can't
a
hear you,
woman,
please.
can you hear me now?
Yes.
Okay, so I said you touched on my next question. As a partner of someone going through this depression that we are talking about
Mm-hmm.
now, what can I do if, for example, I don't even know, or maybe the wife hasn't spoken to the husband, or she hasn't spoken to her partner about the whole situation, and I feel like I'm seeing symptoms about what's happening. So what
Mm-hmm.
can I do? How can I help out?
So, like I mentioned earlier, um, there's a lot of stigma attached, right? And mothers tend to be very careful or very guarded about what they say at this time because of the stigma. Like you're not ready to hear anybody coming to tell you one thing or the other that you are not at this point in time, right? So yes, some women may cover these things up in the name of, oh, I'm just tired. Let me just get some rest and I'll be fine. But if you as a partner, as a friend, you're beginning to see some of the symptoms that we mentioned earlier in this woman, what you can do is try as much as possible. I said it, like you can always help. There's always something you can do, right? Let's start with the most basic things. You can, if it's a friend, you can always call up, oh, okay, I'm coming to your place. When you get there, help out with simple chores. Like, okay, what do you need? Do you need me to help you get something from the grocery? Do you need me to, whatever it is, right? Just help out because chances are they may not be able to ask, but when you offer, at least even if they don't allow you do it, but they know that you are
Yeah,
there for them, right?
yeah.
They know that there's a support behind them. So that's one really important thing that you can do. Secondly, if you notice this, if a partner notices this about his wife, what you can do is try to get her out of the house at least, right? Try to get them
Out of
out of
the
the house.
house.
Yeah, out of the house. Like, just get a little bit of air that is not
But
in the
there's
house from
Corona.
there. In Nigeria, in Nigeria there is corona, but people are able to like move about a little bit. When I mean out of the house, I'm not saying go to like a party or something. You could just go somewhere, just wherever it is. Let them just get a different scenery. Just something else aside the house, the baby, the kitchen, the whatever it is. Just get them a little bit out of the house. Show support as much as you can. People, it's just like every other thing. Most times people find it difficult to ask for help, right? But if I'm going through something and somebody notices it and they're like, oh, Sandra, what do you need? Do you need me to get you food? Do you need me to get you this? Do you need me to get you that? Even if I say no, when I'm ready to open up about something, chances are I'll come to you because you have shown that you are really interested in how I'm, right? But as much as you can and let them know that you are actually there for them. And then speak about it. If they are not willing to talk about it, you can confront it. Ask them, how are you really doing? I've noticed this. Is there anything else going on? Is there something you would like to talk about? Right? Ask them plainly. It's not going, you are not putting the idea in their head. If somebody's actually going through PPD, if you ask them about it, it would help them actually open up. Even if they're not willing to talk about it right there and then, chances are, like I mentioned earlier, they would speak to you about it when they are ready. Right? So the most important, the key of all of these things is just show support, genuine support. Ask them how they are really, really doing. Offer to take the child and let them, take care of the child and let them just get at least maybe 7 hours of sleep or wherever it is. Just offer, show utmost support, and then if somebody, maybe by the time you speak to her about these things and she eventually opens up to you and is like, oh yes, I think something is wrong, I think this, fine. Right now the next step is, okay, so I know so and so therapist, would you be open to speaking to one? Let us book a session. Just show support to them. That is the most important thing that you can do for anybody.
Okay, thank you. Okay, so I just want to say, if you have any questions, please put them in the chat. We'll be taking questions after this. I have like 2 more questions to go, and then we can take your questions. So I have another question based on all that you have. If I let it go, if I don't treat it, if I don't see a therapist, I just wish it away, basically. I don't get medication, I don't do self-help, and I just wish that it goes away. What are the risks? What is bound to happen eventually? Or what might
So let me ask you a question. So you have, you notice that you've been feeling very sick, you have severe headache, you've had all kinds of things going on, and then you do a test, you do a malaria test, and it comes out positive that you have malaria. And then you just sit down, you're like, you know what, yeah, this malaria is going to go. I'm going to pray it away. It's going to go. You're just there. You're not doing anything.
Sometimes your immune system fights
Yeah.
for it. Yeah?
Yeah, sometimes it does fight for it, but what about the other times that it doesn't?
So what's going to happen?
So that's the thing. So yeah, it's basically the same thing. People tend to look at issues with mental health like very far-fetched or something. Look at it the same way you look at your physical health, right? Chances are, like I mentioned, if it's baby blues that the lady is experiencing, it may just go away with time, right? But imagine if it is not just baby blues. What is going to happen is your mental health is just going to keep taking a down toll from there. It just keeps getting worse and worse and worse, and then you keep detaching from your child. So women who do not seek help, women who are experiencing postpartum depression and that don't seek help, most of them tend to have issues bonding with their child afterwards, even after they finally even after the whole depression phase is gone, right? They tend to have issues bonding with their child. So there are a lot of risks involved. There are a lot of things that I don't even want people to even think about. So if anything is wrong, the first thing that should come to your mind is, okay, here's the road to the nearest therapist. That is the first thing that should come to your mind, right? So please, 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 I always beg people, look at it. We should stop looking at mental health like it's one far away something. It's really not. Yeah, it's really not. It's something very, very close to home. So if you're experiencing anything, key is just look for the nearest therapist close by, and then try self-help, try everything tryable, and then I'm sure you'll be fine.
Okay, my last question for the evening is this. If I do all of this, I do the self-help, I see a therapist, I take medication, but in some magical way, oh, I still do not feel better. Even maybe months after I started taking treatment, I still don't feel any connection with my child. Or I don't feel happy. I feel very depressed. So what do I do? Do I keep on doing this, or what do I do? What do I do?
Yeah. So I'm always linking it, because that seems to be the only way that most Nigerians tend to understand mental health issues. I'm always going to link it to your physical health, right? So you have malaria, and you are trying so hard. You've taken medication and you've done everything. They said rest. You've rested. They said drink 6 liters of water a day. You've drank it, and they've given you all kinds of medication, and you've taken all of them, and it's still not working. What's the next line of action? If you are actually seeing a real doctor and a good doctor, right, what they are going to recommend, they'll keep changing your dose. They'll keep trying to find new things that work. So when it comes to therapy, for instance, therapy is not just this one thing, right? There are different techniques in therapy. There are different, what's it called now? Basically, they're just different. I can't remember the right word right now, but they are basically different strategies, different plans. So what happens in therapy is, especially at your first session, you and your therapist talk about, the goals that you have for this therapy, what you want to achieve, where you guys see yourself afterwards. And then in the course of your therapy session, right, you're going to evaluate your progress. You're going to evaluate your progress. And if your therapist realize, or you also realize, that you're not making so much progress, right? Whether with medication, whether with therapy, with self-help, with everything, your therapist is also going to help you to find new ways. Now you're going to do sort of like a reassessment, right? You check, oh, okay, so you've not really made so much progress. Why don't we try this technique? You try that. If that's not working, and then maybe after a couple of times, there are some therapists that know what they are doing, and they'll be like, oh, okay, you know what? I'm just going to refer you to somebody who possibly specializes more on this topic, right? And then they will refer you. And then by referring you, it depends. So like I mentioned, but trust me, the goal is, if you're seeing a proper therapist that knows what they're doing, and you've been recommended the appropriate medication, I'm sure you will definitely see changes. I mean, with the help of also people around you, you will definitely see changes.
Okay, thank you so much. Okay, let's see the questions that we have. I think we have some questions. Sorry, I'm trying to get to the question.
No problem.
Okay, the first question was by Odukale Toluwalashe, and it says, how do you simply differentiate between baby blues, postpartum, and puerperal psychosis, and at what point? Sorry, I missed the question. I'm sorry, I tried to read the question, but that's probably okay, so how do you differentiate between baby blues, postpartum, and puerperal psychosis, and at what point should one seek help?
So the thing is, we've actually covered most of these things when we started, right? We've covered most of these things, but like I mentioned to her earlier on, there's one thing that you can use in differentiating this thing. It's usually the time frame, right? The time frame for baby blues and whatever kind of with baby blues and postpartum, right, or whatever it is, it's usually the time frame, right? Like I said earlier, there are some women who experience baby blues for a couple of weeks, and then they are fine, right? There are some others that, when it comes to postpartum, some people experience postpartum depression even up to a year after giving birth, right? So it just depends. And then you look at also the symptoms that are also accompanying this. The anxiety, because when I'm talking about anxiety, I'm not talking about the usual, you wake up and you're like, oh my God, there's this intense fear about, how you're going to handle your child that day, how you're going to deal with all the things you have in front of you. And also there's, when you begin to experience feelings of harm, like you want to harm yourself or you want to harm your child, or even other people around you. At this point, please seek help. I told her earlier on that most times we all know when something is wrong. We all know when something is wrong. The major problem is just that we have an issue coming out to say in the public because of the stigma attached to mental health related things, right? We just rather, oh, everybody's hush hush. Even when somebody, if a child comes and tells their parents, oh, I was diagnosed with anxiety, the first typical Nigerian mother or father's response would be like, God forbid, not my child. Right? That's the first thing. Yeah, that's the first thing. And I remember somebody was telling me the other day that when her parents found out that she was diagnosed, they started taking her to church, that, all of these things, you're just making the person feel like, I mean, next time if something as serious or something else comes up, they are not going to talk to you about it because you've made them feel some type of way already, right?
Yeah.
So, like I said, something is wrong, you know it, you definitely know it, except you're somebody who is just very dismissive about yourself or about your person, right? When something is wrong, you definitely know it. So the key is just seek help early. That is the most important thing. I said it earlier when we started this live session. If you can, go to therapy even before you birth your child. Go to therapy, right? That is one of the best things, one of the best investments that you can do for yourself.
Okay. So because I don't know what that question was, because I didn't understand the question fully, I need to ask, what is puerperal psychosis? I don't think I've ever seen that before.
Hello?
Can you hear me?
Hello, can you hear me?
Yeah, I can hear you. Can you hear me?
Hello? Is it
I can hear you, Sandra.
my
Can you hear?
frozen? Your break. Uh,
Can you hear me? Hello? I think there might
this
be
my network.
Sandra.
Guys, let me know if you can hear me.
Can you hear me now? Oh, I have to add her again. If you have any more questions, please send them. Sandra will be taking the questions as soon as she's back. Oh, Sandra. Okay, while we're waiting for Sandra, please send in your questions like I mentioned earlier. She should be on in a few minutes or seconds. I think our network is really bad.
So sorry.
Hi.
I am so sorry. I had a call, so my network went off for a second.
Okay, that's fine.
Yeah, so sorry about that. I had a
Yeah.
call.
And
Yeah,
so
sorry. Please, what was your question?
time is fast spent, so I think we have two more
Mhm.
questions after then.
All right, we can take a few more, then we can
Yes, so
leave, I guess.
the next question by Odukale Tolualashe also says, do men, that's fathers, experience postpartum depression?
Can you hear me? Yes, I can hear you now. You said, do
Yeah.
men?
Do men experience postpartum depression? Do fathers
Um,
experience?
yeah. So chances are men could experience. I mean, because for men who are very how would I phrase this now? So some men are very concerned about their wives, right? And then the whole period, you see some men say things like, "Oh, when she was in labor, it was like we're both in labor together. The whole time she was pregnant, we were pregnant together," right? And things like that. So remember that it's just like depression generally, right? Depression is not just, it doesn't affect only women or only men. It can affect anybody. In my opinion, I believe that men also can experience postpartum to a degree, right? Because they also, it depends on what the cause could be. So it could be, they may also be under a lot of stress, leading from before the arrival of the baby till even the arrival, maybe when they're trying to help out with the wife, help out the wife, maybe let her get some rest. They are trying to run around, do so many things. So there are a lot of things that could also contribute to that, but I believe that men also could experience postpartum to a degree, but maybe not as much as women, but to a certain degree. But remember that postpartum depression it's mainly in women. Women experience postpartum more than so.
Okay. Okay, so our last question
Okay.
is, what is the root cause of postpartum depression? Is it based on hormonal changes or experimental stress? And that's by
Okay.
Oinstein. Did you get that?
See you guys. Next time that Bloom Health says there is a live session by 7 p.m., join by 7 p.m. Because most of these things we have covered it earlier on. We have
Yeah.
covered most of these things earlier on. So just to mention them again, I talked about I think 3 or 4 major things that could contribute to experiencing postpartum. So the thing is, you can't say there's just one thing that is causing this woman, and that woman to experience postpartum depression, right? It could be as a result of a contributing factor for so many other things. Meanwhile, it could be, but some of the things I mentioned earlier was one, hormonal changes. I mentioned that the level of right. I mentioned that the
Wait,
level of sorry.
there's a comment by the person who asked the question. She said experiential stress, not experimental. I'm not sure if
Oh, okay. I'm not sure where that comes in, but all right. So, like I was saying, it could be as a result of hormonal changes. The lady, as a woman, you just gave birth, so a lot of your emotions are just playing around, jumping everywhere, and doing so many gymnastics, right? So that could be a contributing factor. We talked about sleep, lack of sleep being a contributing factor also. We know that you're trying to take care of your child. We know that you're trying to be there for your child. We know you're trying to keep everything else in place. You're trying to play super mom, but please, please, please remember that lack of sleep is going to cause you to experience lack of concentration. You're going to find it difficult to concentrate, even in things that are very, very small, small things. You find out that you're probably forgetting some of these things, and it's going to affect the way you also think about other things, thereby leading to postpartum, and the cycle just continues, right? And then we also spoke about if I remember clearly, I know, okay, yes, we also spoke about anxiety, right? We also spoke about anxiety, especially, like I mentioned earlier, especially for new first time moms, right? A lot of first time moms may experience severe anxiety after they give birth. Because I mean, this is a very new experience for you. This is something that you have never experienced before. So it's more like, it's just like when you're traveling to a new country or you're trying to live alone for the very first time in your life, you know, so
Yeah.
many things. You're trying to balance a lot of things. So yes, these are things that could contribute to postpartum depression, and it could also be as a result of all of these factors combined together. So there's just not one thing leading to that we can say, okay, this is it for this person, and so that means it is for every single person. It is different for everybody.
Okay. Well, that's the last question. Thank you so much. So if there's
You're
one
welcome.
thing that you would tell a person, a woman going through this, or a couple going through
Hmm.
this, one advice for them before we leave.
So there are two things I want to do before we leave. I hope time permits. Bloom Health really permits. There are two things I want to do before we leave, right? The first thing I want to do is, as individuals, just so we can help these mothers, right? Because it's really difficult for them. This is a really tough time for them. So the first thing I want us to do is, as an individual, you can help them. How? Possibly start by sharing Bloom Health page to them. You know, let them know that, oh, okay, there's a community out there. Share this live session afterwards. I'm sure Bloom Health is going to save this. Share the live session afterwards. Let them know that you genuinely care. Start the conversation with them. You know, this way we'll be able to actually let go of this whole stigma thing in this in our community. Because the more we are just out here, everybody's hush hush about every single thing, you find out that it becomes much more difficult for people to actually speak about. Because I mean, if nobody is talking about it and I say something, somebody will tell me, "Oh, you're not the first person to give birth. You're not the first person to be pregnant." That's very hurtful, right? It's very, very
Yeah.
hurtful. So if
Yeah.
anything, please let us just try as much as possible. Provide resources for these people. Let them know that there's a community out there. Let them know that they are not alone, right? Provide utmost support as much as you can. And then if you are a new mom listening to this, watching this, whenever, if you're a new mom, please, please, please remember that you are not alone. Trust me. The moment you find the moment you find the community, you realize that there are so many people that actually go through this. Remember when we started, I read out a statistics for you, something about there's 1 in 7 women, right? 1 in 7 women that give
Yes.
birth actually experience postpartum depression. So just imagine that statistics. You are not alone. It's a lot, and yes, people are quiet about it, but I'm glad that these days people are becoming much more open. So please, whenever you have any issues, speak up. Own it with your chest. Say it as loud as you can, because nobody, if anything happens to you, people are not going to be there to take care of your family. They're not going to, the top things that they are going to do is, oh, she was such a nice woman. She was this, she was that. But that's it, right? Take care of yourself. You come first. Don't let anybody tell you otherwise. Take care of yourself. That's where I'm going to draw my curtain. So,
Thank you so much. It was so good to have you here. We hope to
welcome.
see you some other time, talk about some other things. All right. Thank you so much.
Sure,
And you
definitely.
add